Hi, my name is Keim, and today we are going to be going over my case study presentation one. Okay, so here we have the client overview. So this is some information surrounding the client. This is the client's demographics. So the client is 8 years of age. Their diagnosis is autism spectrum disorder. So this diagnosis was done in center through the diagnostician. Um, and the behavior of concern is elopement. So this elopement is anytime that they are leaving the designated area, specifically and typically during table time. Okay, so negative reinforcement contingencies. So um, we found that the client, when they would elope, it was typically throughout table time. So anytime that there was a high quantity of demands being placed, or very fast-paced demands, the client had a tendency to get up and elope from the table, to get up and move away from the table. Um, Now, this we found was being reinforced by escaping the demands each time that they were to leave the table. So it was being reinforced because each time that they did elope, the demands were dropped. So that effectively means that they were being reinforced by evading the demands that they were trying to originally get away from. The function of the behavior was escape. So in turn, they were able to escape, which reinforced the eloping. So in order to draw these conclusions, assessments obviously had to be done. So a functional behavioral assessment was conducted. So within this functional behavioral assessment, an interview was done with the client's mother in order to obtain data and information on the client's behavior, and get an insight into what that behavior looked like and some possible information regarding it as a whole. Um, ABC data was also collected. So this data was collected in order to better understand the antecedents of the behavior, what was happening before the behavior was transpiring, and what that uh, impact was that had the behavior occur, and also the consequences that were occurring, that were reinforcing the behavior of elopement. So after the assessment was conducted, the antecedents were understood, the consequences of the behavior, the intervention was decided upon. It was decided upon that functional communication training was going to be implemented as the intervention for the client. So within this intervention, in the instance that the client was beginning to show any like preliminary signs or potential signs of eloping, they were prompted to press the I need a break button on their AAC device. So the client uses an assisted speaking device. And so on their homepage, there was a button placed that was, I need a break. So they were prompted with a gestural prompt to use the button in the appropriate manner. So if they did not reject the gestural prompt to the button, the client was then provided with a 5-minute break and very happy verbal praise. So as the client progressed, we obviously began to feed back the prompt. So as the client was able to move through the intervention and show that they were able to process through, we began to only reinforce the break with verbal praise, the break and verbal praise, when the client was able to independently press the I need a break button on their device. As the time went on to, the duration of the break was gradually decreased. So it went from a 5-minute to a 4-minute to a 2-minute to a 1 minute. The schedule of reinforcement was an FR1 schedule. So that meant that each time that the client appropriately mandated for a break using their replacement behavior, they were provided with the break, and also with a verbal praise. This was continued through, but as I stated, the duration of the break was dwindled down. So motivating operations were huge in this instance. So obviously the function of the behavior was to escape the demands being placed at various times throughout any like table work that was being done. So that escape and that function of that behavior was really focused upon within the designing of this intervention. So ensuring that the replacement behavior was like able to offer up that same um, function and provide the client with the same reinforcement was key in it being able to work. So the client being able to use the AAC device, the button, the I need a break button, and being able to receive that break and that reinforcement allowed them to use the appropriate response, and move away from the eloping behavior, as they were receiving the same outcomes from both behaviors. So they were able to use the appropriate reinforcement behavior and still get the break that they desired. So motivating operations were focused upon heavily in the designing and implementation of this intervention. So generalization and maintenance are, of course, extremely important. So this was something that was going on both at home and in center. So the client, any table work that that was being done at home, the parents were using the same prompts and the same reinforcement. There was a parent training that was conducted to fill the parents in and have them have a deeper understanding of the program being run. So this allowed them to run the same program at home during any table work, any homework time, anything like that. And that way it was able to generalize this across settings. So not only in center, but also at home. In regards to maintenance, the client was actually able to meet their goal. They reached the mastery level criterion, but the intervention is still run. And so this means that like while the intervention is still run, data isn't continuously collected, but there is maintenance data collection on Wednesday. So every Wednesday there's data collected just to ensure that everything is still on track, and that the client is still able to use the functional communication. So the outcome for this intervention was that there was a functional relationship between the dependent and independent variables. The intervention did prove to reduce the elopement behavior. Within the first few weeks of implementation, there was already a clear decrease in the behavior of elopement. So the prompt fade and the reduction of break time were also received very well. So as it was reduced, the client had a very good reaction to it and was able to adjust. They were not prompt dependent, and they were able to make progress as time went on rather quickly. The only obstacle that we did run into was an outside factor. We found that on days that the client did not get a sufficient amount of sleep, that they had an increased rate of elopement. We would ask their caregivers as they came in how the client had slept, and we started to find that on days that the client did not sleep well, there was an increase in elopement behavior, which obviously did skew the data a bit. However, that was really the only barrier that we found within this intervention. The intervention was taken on very well by the client and was implemented very well. Um, and it proved to be effective in reducing the client's overall elopement. So it was an effective intervention in regard to the reduction of the elopement behavior. Thank you so much for your time. This is the conclusion of my case study presentation one. Thank you.